Pneumatic compression pumps and devices are used to treat and reduce swelling in an area of the body for a wide range of conditions. Medical-grade compression pumps and devices are helpful to reduce swelling and move fluid out of a congested area, which can help improve mobility, lower the risk of wounds, and help avoid infections. My name is Kelly and I am a certified lymphedema therapist and a physical therapist. And today in this video, I'm going to show how a leg compression pump is used and tips to make setup a little easier. Before we begin, make sure that you subscribe down below for weekly new videos. You can also follow along with us on Instagram, or you can check out my website for more resources. Before using a pump, you want to make sure that you get clearance from a doctor. At least here in the United States, FDA cleared pumps are usually obtained through a prescription from the doctor for various medical conditions like lymphedema or vein issues. Some may use a pump for the arm and the chest, or others may use it for the legs with or without a trunk piece or abdominal piece. Pumps are often prescribed to be used daily. Some may use it daily, while others may use it weekly or a couple times a week to manage. It varies person to person and how they use it for their self-care and self-management program. There is no one correct answer that fits everyone's needs, but rather what you and your doctor decide together. Pumps can be a challenge for some to set up due to the size and the positioning. So let me share what some of my patients have found helpful. I am going to be using the Aeros medical pump for this demonstration. I want to thank Aeros for providing the pump for this video. First, it's not ideal to be wearing any bandages or garments while pumping to avoid tourniquets or the skin having issues from that. So many find the best time to pump is first thing in the morning or evening while they transition in or out of their garments for the day. Next, you want to find a comfortable spot. Some people will use the couch or the bed to either lay down or sit up so your legs can be stretched out. Make sure to have pillows ready for back support as needed. The machine will need to be in reach for some of the pumps, while others may have an app, so you might have to have your phone nearby. Next, when you sit down and place your legs in the pump, a barrier for many is closing the pump. So if I put my legs inside, some people have a hard time reaching the zippers to close the pumps. So there are also pumps that Velcro close and some that have zippers. If someone has a lot of issues reaching their feet and can't rely on someone else to help each time, the zippers are a little bit easier to close and do on your own. What someone can do is clip or tie a string or a wand to the zipper, and then you don't have to reach as far down to pull them up when you're inside. Someone gave me the tip that they used a short blind wand that is sturdy but flexible where the clip is to give them leverage. This allows them to be independent when getting into the pump. So be creative, but if you have any other tips that you use, you can share those in the comment section down below to share with others. When you're all set up, you close them up. And then we want to make sure that you plug it in. You can have it plugged in prior. So then when you're set up and comfortable, and make sure you get your pillows if you want it, you can start it. Most programs or most pumps are pre-programmed for you, and so that you don't have to, there it goes, you don't have to set anything up. It is set for you on the machine. There might be different kinds. So just make sure that it's plugged in, and before you start, you might want to grab a book or the remote or something to do that you can go ahead and relax with. You'll feel the pump inflate and deflate in a sequenced pattern in the direction we want to move the fluid. So it will be a similar pattern to that of lymphatic drainage, which is what the pumping may take place for someone's self or home management. Once the cycle and session are completed, the pump will turn off. The great thing about the Aeros pump is that it will completely deflate and all of the air will empty out of them. After that, you're all done and you can move on with the other skincares and back into garments if they are used. If you have any specific questions or topics related to pumps you'd like to see in upcoming videos, please comment those down below, or you can check out my channel and my website for other resources. But other than that, we'll see you all in the next video. Thanks everyone.